You may get the front 6 teeth all straight and pretty, but if you don't get the back teeth lined up properly, they can cause damage to the joint.
Dr. Ellen Sprinkle reveals how our well-being is rooted in the way we bite.
There's a huge percentage of the population that has chronic headaches, and 85% of those headaches are caused by muscular disorders that are created by your teeth improperly coming together. Your jaw, and that excess friction can damage the joints even further, but it can also create a muscle response that results in chronic head and neck and facial pains.
I had a very intense stress job. The stress was there from life, and things that I've gone through previously all worked itself into a powder keg situation. All of a sudden, my ears, it was pretty much consistently ringing. It is the loudest sounds you'll ever hear. I feel like there's knives just chiseling into your jaw and your neck, and someone's just slapping your face with a sledgehammer. Utter agony that I can't encapsulate with the human dictionary. So I went doctor to doctor, specialist, North Dallas, South Dallas, East, West. I mean, I went to them all. And I'm 30 years old, just turned 30, and I get told by a doctor, you have high-pitched frequency tinnitus, there's no cure, it's just your life. It's not a big deal. Just the worst news you can ever hear. Things started to look better when I got recommended to go to a chiropractor from a Christian nurse, and the chiropractor immediately said, you need to go to Dr. Sprinkle. He was able to examine me, and within a matter of minutes could tell me everything that was going on. He said, if it's TMJ related, then all we need to do is fix the TMJ, the ringing will go away. And I'll tell you what, I'll never forget when I heard the sounds of feet, and I could hear the rain, I could hear birds. But I'll never forget hearing my mom and my dad's voice, because I forgot what they sounded like. I've spent tens of thousands of dollars on doctors who didn't do anything. Surgeries that I didn't even need. But since I've been working with Dr. Sprinkle, that pain and the intensity has been diminishing every single time. The good days get better. The bad days are nothing like they used to be. Thank God for Dr. Sprinkle, because your outlook is of hope and faith.
My problem with root canals is the fact that I was told in dental school that 90% of all teeth have accessory canals. And that's a canal that comes off the side of this main canal. And that can get bacteria in it. And I've been doing this for almost 40 years now, and I've seen maybe 5 accessory canals that were ever filled on a root canal. Now, there are lots of people walking around that are healthy and don't have any issues that they're aware of with their root canal teeth. Won't get a silver filling in my office, or more rightly termed an amalgam or a mercury filling. We don't do that. We don't use fluoride in my office, and we don't do root canals. And we look at the patient as one whole unit. I'm just not a tooth carpenter or a dentist in the fact that all I work on is mouth. All I do is work on the mouth, but I respect the fact that what I do can have tremendous influence, for good or bad, on that patient's well-being and health.